Good evening. Cystic fibrosis is a killer, and chances are you or someone you know will be affected by this dreadful disease during your lifetime. Cystic fibrosis is an inherited disease, which means it requires two mutated CF genes, one from each parent, to manifest in a child. This gene is located on chromosome 7, and researchers have found over 1,800 mutations of this gene, some causing milder symptoms than others. These mutated genes produce an abnormal protein called the CFTR protein, that's cystic fibrosis transmembrane regulator. This protein causes mucus to be thick and sticky instead of thin and watery. An apt comparison between the two would be the difference between molasses and saliva. There's no cure yet, and there's no remission. It's a daily fight for a CFer for the rest of their life. Cystic fibrosis affects many different systems in the body, including the respiratory, digestive, reproductive, cardiovascular, the endocrine, and the skeletal system. But I'm only going to talk about 3 today. In the respiratory system, this thick, sticky mucus plugs the small airways in the lungs, inhibiting airflow and the exchange between oxygen and carbon dioxide. It provides a prime growth environment for bacteria and many types of fungus. These cause frequent pneumonias and lung infections. Each flare-up of pneumonia and lung infection scars the lungs more and more, diminishing the capacity of the lungs' vital capacity. My daughter once told me that having CF was like trying to breathe through a drinking straw. Those 2 breaths put a strain on my body. I cannot imagine having to do it 24 hours a day. The treatment for this is a daily regimen of inhaled nebulized bronchodilators, antibiotics, and then percussion therapy on the chest, like this. These medications and the chest therapy helps loosen the mucus in the lungs to where coughing, intense coughing, can expel this mucus up and out of the body, and it can be spit out. Each treatment lasts 30 to 45 minutes, and as I said, 3 to 4 times per day. In the digestive system, the mucus blocks the pancreas to where digestive enzymes cannot be released. These enzymes are what digests the food and releases the nutrients contained in the foods to be absorbed in the intestines. The only course of treatment for this is to take pancreatic enzymes, capsules, sometimes upwards to 20 or 30 per day. Additionally, specialized vitamins are recommended, and an increased caloric intake is vital, sometimes upwards of 200% of the normal RDA. My daughter and son's doctor, CF doctor, recommended that they have at least 4,000 calories per day. I can't do that. In the reproductive system, males have an additional effect to deal with. This mucus blocks the vas deferens tubes, which almost certainly guarantees infertility. Surgery may be successful in treating this. When a person only inherits one CF gene from the parent, they're called a carrier. They exhibit no symptoms of CF. There's estimated to be in excess of 10 million carriers of the CF gene in the United States alone. Assuming the population of the U.S. is 300 million, that's 1 in 30. If you know 30 people, chances are one of them carries this mutated gene. There are an estimated 30,000 people in the U.S. with CF now, and 70,000 worldwide, with more than 1,000 new cases diagnosed each year. I've gleaned this information from the Child Life Society, the Cystic Fibrosis Foundation, the National Institute of Health, the Mayo Clinic, and personal experience. Thank you very much for listening.